name's Dr. Stephanie Wallman, and I am the medical director at the Lanby. Today is my one take on one take in what is functional medicine and why should you have a primary care doctor who's trained in functional medicine. I get this question all the time. When I say, oh, I'm a family medicine doctor, but I specialize in functional medicine, everyone looks at me like, what's functional medicine? And what I really want you to know is functional medicine takes all the good that comes from the traditional training of a primary care doctor, which is utilizing testing, lab work, and medications, and ties it in with everything else like lifestyle, diet, exercise, movement, stress, relationships, all the things that are really going on in your day-to-day life that we don't always think to bring up to our doctors. I think it's so important to make sure that your doctor knows, hey, I'm about to get married in 2 months from now, but I'm feeling sick. I want to be my best at my wedding. I want to make sure I'm optimizing and our goals are aligned before they write you a recommendation for something that maybe the timing doesn't quite work out for you. I think it's important to understand is I'm having a really hard time dealing with this stress at work. And instead of just focusing on, hey, let's get you some anti-anxiety medicine, we can talk about, actually, my dad just passed away a couple months ago, and I'm really struggling with that grief. That's what a functional medicine doctor can bring out in you. They can really get to know you. They can understand you. They can incorporate changes in your life far beyond the 5 to 15 minutes you get with your traditional primary care. You're getting a lot of time to meet with your doctor, to talk to them, for them to start to understand you so that when they make a recommendation about a supplement protocol, they're not making that supplement protocol recommendation 2 weeks before you're about to go on a trip to the Bahamas. They're going to make that recommendation after you're done with your trip. They're going to understand who you are, where you're coming from. They're going to understand that you want to plan for a baby in a year from now. And their response to you isn't going to be, come back in a year and we'll start you on a prenatal. Their response is going to be, let me get you prepped. Let me get your body thriving. Let me get your body in the best place it can possibly be in to welcome this life into the world. And that's the difference between a primary care and a primary care who's trained in functional medicine.
Thanks for tuning into this episode of Get Well Better by the Lanby. Your support truly means the world to us. Make sure to subscribe on YouTube and Spotify or listen wherever you get your podcasts. Follow us on Instagram at the Lanby for behind the scenes content and updates. We would not be able to grow without your support and referrals. So please send this podcast to a friend, a loved one, anyone who you think is interested in learning more about health and wellness and navigating this maze of an industry.